For this week, I'm going to be talking about a current event that talks about emotional support and service dogs. You are starting to see these dogs in a lot of different places, like malls, restaurants, airports, a lot of different places. But I think that to start talking about that, we need to define the difference between emotional support dogs and service dogs. An emotional support dog is also called an ESA, or an emotional support animal, and that is a pet that needs to be prescribed by a licensed mental health professional to a person with a disabling mental illness. A therapist, psychologist, or psychiatrist must determine that the presence of the animal is needed for the mental health of the patient. And a service dog is a very different thing. The American with Disabilities Act defines service animals as dogs that are individually trained to do work or perform tasks for people with disabilities. The Act clearly states that animals that simply provide emotional comfort do not qualify as service animals. Some state and local laws have a broader definition, and it tells you to check your local ADA or to see if your ESAs qualify for public access in your area. For service dogs, this could be someone that is blind. Their dog will basically be a guide dog, show them around. As for emotional support animals, studies show that emotional support animals can provide a comforting presence to handlers that suffer from a variety of mental issues. As the benefits of using ESAs grow, doctors are now expanding their patients to many different things. One of these main things is PTSD, which there was a current event on where a firefighter got PTSD and was put on day shift, and then now there's a whole lawsuit about it. But I believe that ESAs are very important for people with PTSD, as dogs have been clinically proven to help with mental illness and anxiety and a lot of things. So much to the fact that my sister does have an ESA, and it has greatly helped her. They can also help with mild to severe anxiety, depression, general anxiety disorder, social shyness. But I believe that this is prevalent to the way that we as firefighters will do our business, because we will be in contact and we will be in very stressful and dangerous situations that I believe could cause PTSD or anxiety or depression or anxiety. And I think that we need to be prepared for these possibilities. I think that firefighters should be mentally tested at least once a year to make sure that they are mentally sound and just have a control of their emotions and their mind, so that they can keep on and continue doing their job without affecting the performance and capabilities of their peers. Thank you.